Milton, of course, coming less than 2 weeks after Hurricane Helene tore through much of the southeast, and full impact of the hurricane still unknown, but the effects being felt all across the country, including right here at home. All week long, we've been following the ongoing IV fluid shortage, causing local hospitals to cancel most elective surgeries. That shortage due to flood damage at a key medical supply facility in North Carolina. Baxter Pharmaceuticals makes up 60% of the country's IV fluid. Hundreds of workers are still missing from the plant, so there's no telling yet when the facility may open. Now, the state health commissioner voicing earlier today that the health department is monitoring the shortage and is working with state hospitals and first responders to get a better understanding of supply, which is why I check in to learn how local hospitals are adjusting. And I made a stop in Williamsville, where the owners of a local wellness center say that if they do not get the IV fluid soon, they may have to close. Buffalo Hydration is home to an elective medical spa that treats at least 200 people a week, a majority of which come in for IV fluids.
A lot of people benefit from just the vitamins, even if it's not the hydration. What's unfortunate about it is we'll have to turn people away that we normally wouldn't. And that's actually going to be a lot worse for those people because our services keep people out of the emergency rooms.
Amanda Hicks is the co-owner of this wellness center, which was created almost 6 years ago.
Your hydration status is really important, and it's a key factor in a lot of chronic disease.
She and Julia Cerny, who is one of the registered nurses on site, are now having to get creative since there is a lockdown on IV fluids for medical spas like theirs and even doctors' offices.
Just minerals in a syringe rather than putting the minerals in the actual liter of fluids. So the person is still getting all the vitamins and the minerals through the IV directly into the bloodstream, but they're not getting dilution. They're not getting hydration. So they're getting the same exact medicine, just no hydration.
But if the shortage persists, it could put them out of business for a while. Area healthcare systems have also had to get creative. Here's what Oshai Children's Hospital President Dr. Stephen Turkovich told our Taylor Epps on Voices this week.
We put together new clinical protocols to make sure that we can rehydrate children in particular using oral fluids. Gatorade in particular is really effective. Hopefully open up some avenues that aren't available right now, including IV fluids from other countries.
And here's Catholic Health Chief Physician Executive Dr. Victor Philidora.
First thing that we do is put the patient at the center, and make sure that we're safely caring for our patients and making sure they're getting the best care that they can get.
Meanwhile, Hicks at Buffalo Hydration tells me they are anticipating a 4-month lockdown, but things could change. And while the IV fluids are being allocated to people in need in emergency rooms, dialysis centers for chemo treatment and such, Buffalo Hydration will continue to receive medical advice from their medical director, pharmacists, and representatives for the best way moving forward.